So let's talk about what other types of urinary incontinence there are and what are the causes which underlie them. There's something which we used to call urge incontinence, which we now call overactive bladder. I'm sure all of you have seen some of the television commercials for the OAB drugs, or what they call the gotta-go drugs. Basically, an overactive bladder gives rise to the need to urinate or the urge to urinate with the inability to control it. And what happens is that there is a sudden urge to empty, not enough time to reach the bathroom, and there's a sudden uncontrolled loss of urine. That typically is the result of a bladder spasm. So that's a physiologic cause. The other, and perhaps the most common type, is something called stress urinary incontinence. Stress incontinence typically occurs just with activity. In other words, that as a result of the fact that the bladder, which is in perfectly fine shape, but it's the urethra, this is the tube that drains the bladder, it has two functions. The first function is it's a conduit. Quite frankly, it's, for lack of a better term, it's an exhaust pipe through which urine exits the body. But its second function, somewhat underappreciated, is valvular. That is, it functions like a valve. So ordinarily, when the owner of this urinary bladder is not urinating, that valve is supposed to stay shut. With increases in abdominal pressure that come with coughing, laughing, lifting, swinging a tennis racket, golf club, etc., what happens is your abdominal pressure increases, and this urethra, if it sits on a nice firm backstop, the pressure here will increase as well. And the net result is there is absolutely no drainage of urine across this junction. However, if for some reason either this pipe has a problem, or if the network of nerves and ligaments and muscles that support it have a problem, what suddenly begins to happen is it does not maintain its pressure, and every time there's a little jolt up here, there's a splash of urine gets let out. These two can frequently occur together. We call that mixed urinary incontinence. And there's another type of incontinence called overflow incontinence. Overflow incontinence refers to basically a complete shutdown of the bladder muscle. What happens is the bladder fills and fills and fills and fills, and the muscle, which ordinarily should A, notify its owner that the bladder is full, stops doing that. And number two, that muscle also stops contracting. So that what happens is it basically becomes a very passive bag. Although it frequently is a sign of neurologic disease, most commonly it occurs idiopathically, meaning without a known cause.